Good morning, all the participants, and good morning people who are online, because we know that because of the time frame, the time zone difference from Australia to Africa is about 10 hours, and I'm not sure that our people will be able to make it fully as planned. But let me take the privilege to welcome all of you, those ones that try to come, and those ones that are online. Thank you for patronizing us, and thank you for assisting at this session. Before we proceed, let me call Dr. Nagai Henry. These are one of our presenters, our speaker, and also Dr. Bernard Mazima, the CEO of NAC Zimbabwe. As you have seen in the flower, this session is really about Africa. It's first of all about ALCO. ALCO is a corridor project that is in charge of the 5 countries in Africa: Lagos, Togo, Benin, Ghana, and Côte d'Ivoire. And this session is a planned session within ALCO and the Society for AIDS in Africa. As you know, Society for AIDS in Africa is the constituent of ICASA. And today we have the chairperson of the local secretariat, in the name of Dr. Bernard, who will give us the overview of how we are planning ICASA 2023 in Zimbabwe. But before then, let me introduce to you Dr. Nagai. Dr. Henry Nagai is a public health scientist with several fellowships and a member of the International Science Reserve of the New York Academy of Sciences. He is the chief of party of the PEPFAR USAID Care Consortium project and country representative of GSA in Ghana. Dr. Nagai is a visiting lecturer at the Ghana College of Physicians and Surgeons and the Kwame Nkrumah University of Science and Technology, Public Health Faculty in Ghana. Dr. Nagai is a member of the SAA Committee Scientific of ICASA. Let me welcome Dr. Nagai to present to us the survey of ALCO. This survey was done in the 5 countries of Africa, West Africa, and the survey is about the fishermen. We have noticed that the fishermen, this population of fishermen was not well taken care of in Africa. And the survey was conducted in the 5 regions, in the 5 countries of this, on the coastal. I'm talking about Nigeria, Benin, Togo, Ghana, and Côte d'Ivoire. Please welcome Dr. Nagai for me to present the survey of ALCO. Thank you.
So thank you very much, Luke, for those nice words. I'm really stepping in for a colleague who is unable to attend, and I got a slide deck very late, that is this morning. So I'll try to present the various findings of this important integrated behavioral surveillance survey in the ALCO region, that is in the West Africa region. So I will look at the background, the objectives of the study, and also look at some key results and some conclusions. I'll try to go through what the colleague has presented, I have prepared, and then we try to respond to some questions. So West Africa, as we all know, we have about 62 million people in transit every year. The epidemic in the region, it's a mixed type of epidemic, and the fisheries sector contributes about 5% of the gross domestic product in the region. The fishermen that is within the sub-region are known in previous studies to have high vulnerability to HIV. And there is lack of data to assess the extent of these vulnerability by way of mapping size estimations and what kind of behaviors contribute to that level of vulnerability. And therefore, we have ALCO, which is the corridor project that conducted the integrated behavioral surveillance survey among the fishermen in the 5 coastal countries of Nigeria, Benin, Togo, Ghana, and Côte d'Ivoire. So this is to contribute to the knowledge of the situation, as I described. And there are some results that have been obtained, from this study. I know that these details will be uploaded, so everybody can have access to. But there are a couple of things that we need to pick from the study. When you look at the population of fishermen, clearly they are all, most of them are above the age, of 25, but we still have those that are in the ages of 15 to 24. And this is very, very important for us in terms of how we want to plan, how we want to focus on these categories of populations in these 5 countries. This slide actually indicates the various categories of respondents. And if you look at especially when you come to Côte d'Ivoire, you can see that there are fishermen from Ghana and also from Benin that fish within the waters of like Côte d'Ivoire. The same thing when you look at Togo, you can see that there are quite a number of Ghanaians that are the rest of the countries. For example, Nigeria had about almost everybody being Nigerian, but Ghana also almost everybody. But when you look at Ivory Coast and Togo, then that tells us that whenever we want to look at these populations in terms of how we plan, even language and other things, could be critical in terms of how we look at this. This slide actually indicates one key message, the message about the age at first intercourse among 15 to 19 years old across the 5 regions. What this tells us that we need to be able to continue to focus on these sub-age in terms of the population when it comes to the age at first intercourse, so that we'll be able to provide comprehensive sexual education depending on the country's own approaches and what the country has adopted to do. As I said, there may be questions related to this, and my colleague who has not been able to be here to present, probably if it's online, might respond to some of those things by writing. This also tells us about condom use. And it is important for us to, in general, see that condom use during the last sexual intercourse, regardless of the type of partner, whether at risk of HIV or other STIs, is relatively low. The use of condom at last sex lowest in Ghana, and in Benin it's about 62.5 as we see. In many areas we want to see 100% condom use, but we also know that condom use is a kind of a trade-off activity depending on how much money one wants to pay a sex worker, and there are all kinds of negotiations that take place with that. But in general, this tells us that we need to improve our condom programming in the different countries. We need to look at what structures are there, what kind of logistics are needed to make sure that condoms are accessible and affordable within these 5 countries. And so it tells us that there's more work to do even in the area of condom programming. This looks at family planning, and one of the key messages here is that most people are aware of family planning services and are aware of the structures that can provide these services. But when you look at the frequency of attendance that is measured in 1 to 2 times, you realize that this is relatively low. And it's been found that it is as a result of distance. So the region will need to really map out and be able to increase the locations where these structures are to communities so that they will be able to access these services. This is looking at comprehensive knowledge of HIV, and especially when you come to the rejection of misconceptions. Clearly, if you look at the last line here where we have the accurate knowledge and rejection of misconceptions, throughout the 5 countries, that is relatively low. And it just tells us that comprehensive knowledge about HIV requires some more work to be done within the 5 countries. One of the highest that was received, that is, knows that you cannot catch AIDS virus, by sharing a meal with an infected person. It's still something that the highest, in terms of the rejection was in Cote d'Ivoire, and you can see the lowest in Benin. This relatively tells us that there's a lot of work to do. To improve comprehensive knowledge and to deal with misconceptions within the sub-region. This slide just tells us that the level of tolerance towards people living with HIV, is relatively higher among those that have received higher level of education. This we found it to be the same in different countries. What it means is that we need to look at curricula, we need to look at trainings in our schools up to the different levels that we have and try to deepen understanding and deepen knowledge so that we'll get people who will be more tolerant, as it were, because this seems to correlate more with education. The exposure to prevent STIs. What I want us to focus on here is these ever-received free condoms. The idea of free condoms has been always a debate, where we want to either push free condoms or ask people to pay a token when it comes to a condom. But clearly, condom programming across the sub-region, when you look at the previous slides, tells us that we have a lot more work to do if we want to push condoms in terms of preventing STIs and pregnancies among the fisher folks that are there. Less than 10% of the respondents, regardless of the country and gender, reported having received a combination package of HIV prevention interventions in the last 3 months. But when you look at the issues of condoms, either in terms of use in the previous slides or in terms of use during, sex, irrespective of which country, relatively that has been low. We know that the package of services is being provided by the ALCO team across the 3 countries, the 5 countries, but clearly matters relating to condom use need to be re-looked at in the different countries based on their own policies and programs, and to improve further the fidelity of condom programming. Access to HIV testing. when you look at this, regardless of the country of residence or gender, the reasons for not using HIV screening, prevention or treatment services for a number of the respondents is as a result of fear of being stigmatized by health staff or by neighbors. So stigma clearly is a big issue among the fisher communities, and this is something that we need to look at across the regions, whether it's Nigeria, Benin, Togo, Ghana, or La Côte d'Ivoire. This is one of the take-homes that we have. I see from the slide deck that our colleagues put together that the average HIV prevalence, in the 5 corridor countries is about 2.7. The country with the highest prevalence is Benin, which is around 4.6, and the lowest prevalence is observed in Nigeria, that is 1.6. And what it means is that we have a lot of work to do when you look at the absolute numbers in these regions. I mean, 1.6 among the fisher folk in Nigeria is quite a big number, and clearly in some of these countries, the average prevalence is actually higher than the country's own general prevalent levels. But these are details that we can look at later on. What it tells us is that among the fisher communities in these 5 countries, there's more work to be done. There's more work in terms of targeting and providing differentiated services to these fisher men population. Same information is here in a different way. HIV prevalence in the fisher communities by country, and you can see what we just talked about. In terms of the distributions, as you can see, when you look at male versus female, by gender, clearly you can see the face of at least female showing through, except for that of Nigeria, where we have this lower, that's around 1.2%, but in the 4 other countries, clearly the face of HIV, as we always say, is that of a female. This also tells us that about the prevalence, by way of the fishing communities, by country and by site. And I know that the team has details of these, granular details, that is looking at specific sites and even sub-areas and enumeration area information that can be used to target the kind of interventions that are required. This also tells us, a lot about the fishing communities and the adults age 15 to 49, by country in terms of prevalence. So we can look at 15 to 49 prevalence when we look at the fishing communities and those that not fishing communities. A couple of take homes, and as I said, I didn't prepare these slides, but clearly the results of this study looks critically about at what are the vulnerabilities that we find in these fishing communities, that most countries in the sub-region need to pay attention to the fishing communities, increase the condom programming, and ensure that services can reach these communities. The analysis also shows that most of the behavioral surveillance indicators are not as good as we expect. For example, comprehensive knowledge issues about HIV needs to be worked on. Exposure to the risk of HIV among fishermen is a big concern and requires a lot of planning by the countries. The HIV prevalence among fishermen in the 5 corridor countries is relatively higher in general than the average in the general populations. I want to thank you for listening, and I know that if our ALCO team is online, they will respond to some of the questions as you may have. But I will be available as I work also in Ghana, in the sub-region, to respond to some of the questions that you may have, although I wasn't part of the study team. Thank you.
Thank you so much, Dr. Nagai, for this powerful presentation. It's very important to know that the fisher community in West Africa, especially in the 5 regions, in the 5 countries, these are the targeted community of this study. And if you notice the recent development in Africa, especially those ones that are migrating to the Europe, going to Spain, going to Libya, and they are dying on the ocean, those are the fishermen. Those are the youth that are dying over there because they lack every single thing. And it's important that we should call the international community to look at this study and to see how we can scale it up, so that we can provide services to them, as the presenter has just said. Saying that, let me see if you can take some questions before we proceed to the second presentation, or we should do the 2 presentations and then take questions. We do the 2 presentations. Okay. Then let me introduce to you Dr. Mazima. He's the Chief Executive Officer of the Zimbabwe National Health Council, and he's a seasoned medical doctor and public health specialist with more than 20 years of experience. Let me also say that Dr. Mazima is the local chair of ICASA 2023 Zimbabwe. As you know, ICASA is an international conference on HIV and STI that we do organize in Africa every two years. And this year, it will happen in Zimbabwe 4 to 9 December 2023. And the program is well advanced at this stage because now we are in July, and normally the meeting is in December. And we will call the chair of the local secretariat, to give a progress report on how the country is ready and how the planning is going on for the upcoming ICASA. Don't forget, let me give you just a brief that ICASA draws more than 8,000 to 15,000 delegates every 2 years in Africa. Thank you. Doctor?
Thank you, Mr. Luke, the Master of Ceremonies. Morning, everyone. I would like to begin by acknowledging the traditional owners of the land on which we meet today. I would also like to pay my respects to the elders, past and present. Thank you. So, the background of ICASA, I'll start by presenting the background of ICASA. The Society for AIDS in Africa, they are the organizers of the International Conference on AIDS and Sexually Transmitted Infections in Africa. They started in 1989 for the African continent to focus on challenges specifically for Africa, which they were facing on AIDS and STIs. But now there's been an expansion on the program to include diseases like COVID-19, Ebola, malaria, TB, and monkeypox. The conference happens every 2 years. It's biannual, and the official languages are English and French. The first country to host ICASA was Zaire in 1995, and in 2013 it was held in Cape Town. Zimbabwe, this is going to be the second time to host ICASA. It first held it in 2015 from 29 November to 4 December and was dubbed the best ICASA ever. We organized it in less than 6 months, but we had over 4,000 people attending. The then Vice President, who is now His Excellency, the President of Zimbabwe, Dr. E.D. Mnangagwa, opened that conference in 2015. In 2021, we were in Durban, but the meeting, which was supposed to be hybrid because of COVID-19, ended up being 100% virtual. That was when the Omicron virus strain was discovered. Zimbabwe started the journey to win the bid to host ICASA in October 2022, and we did win to host the 22nd ICASA. And a signing ceremony was held at State House between SAA and Zimbabwe, where the Honorable Vice President of Zimbabwe, who is also the Minister of Health and Child Care, signed on behalf of Zimbabwe, and the President of SAA also signed. This was at State House. So this year's event will be at Rainbow Towers in Harare, and the dates are 4 to 9 December 2023. The conference format has 3 components, which are the scientific program, which includes the plenary sessions, abstracts and posters, the leadership program, which will have high-level advocacy events, satellite sessions and workshop. Then the community program, which will include activities for people living with the disease, the youth, people living with disabilities. What have we done so far as a country to prepare for ICASA together with the SAA Secretariat? We have constituted the International Steering Committee, and this committee has met twice, in November and in March, and it came up with the conference theme and the logo, and we also developed the thematic sessions and proposed the speakers. The theme for this year's ICASA is AIDS is not over, address inequalities, accelerate inclusion and innovation. And we are going to have the marathon meeting in September, which will be the final preparatory meeting, and this will be held in Harare. ICASA 2023 will be hybrid, and we expect between 5,000 to 8,000 participants because now we are in free movement. There is no longer any lockdown of COVID-19. We are encouraging people to attend physically to come to Zimbabwe. We have started preparations for the meeting early, and the online registration platform is open, and it shows that people are registering and are also paying for the conference. Zimbabwe is a good destination. Those who attended ICASA in 2015 and those who have heard about the 2015 ICASA would like to come. And Zimbabwe is something to showcase at this ICASA because we are one of the countries which has achieved the 95, 95, 95 targets. And we really want people to come and learn from Zimbabwe. This conference will have 2 high-level meetings before we start the conference on 1 December. I think this will be on 1 December. And we intend to host the pre-conferences in Victoria Falls, a youth conference which is going to be part of the main ICASA in Harare. The first one will be a high-level meeting of First Ladies of Africa, and the ICASA director and the head of the local secretariat. They've already secured the commitment from the Zimbabwe First Lady to host the event. The focus will be of this high-level meeting will be on the elimination of mother-to-child transmission with a special emphasis on the validation process in Africa. The second high-level event is for the ministers of finance in Africa and the business people to lobby for increased domestic funding to fight diseases in our African countries. The third high-level event is for ministers of youth and sport to engage, to come up with solutions to tackle challenges faced by youth. High on the agenda will be the issue of drug and substance abuse and unemployment. These 3 events will bring a lot of high-level dignitaries in the country and give them the opportunity to experience the mighty Victoria Falls. This conference is an international conference, and it will require all of us, those in Zimbabwe and outside in the sector, to work together to achieve great results. And as a country, we really want to surpass the 2015, what we did in 2015. And we know that we will get huge numbers of people coming from across Africa in big countries like Nigeria, Kenya, but also a lot of people coming from our neighboring countries. We therefore appeal to, we are working with various ministries. We have got an inter-ministerial task force, which is now working to put everything together. So this is where we have escalated the issue to the Inter-Ministerial Committee in the Office of the President and Cabinet. In 2015, and again now, we have various departments and committees which are assisting us to ensuring that we organize well. And we are marketing the event to our people and to the international community so that they participate. We are sensitizing the business community of the conference so that they prepare for large numbers of visitors coming, as they will need accommodation, food, transport, security, visas, tourism packages, etc. Above all, we want to market Zimbabwe as the ICASA 2023 destination and other future meetings. Thank you very much for listening. Tatenda.
Thank you, Dr. Mazima. In fact, let me emphasize here that I do not present myself. My name is Luke Armand Boudea. I'm ICASA director and also the coordinator of the Society for AIDS in Africa, which is the engine behind ICASA. Saying that, I think we now start for the Q and answer, because we don't have too much time, but we have at least 30 minutes to take a question and answer. Any question for the floor? Do you have people online?
The results of the IBBSS show the vulnerability of this community. Most of the fishermen does not have access to HIV services, testing, condoms, sensitization, etc. So we need financial and technical partner to fund activities targeting this community. Yeah, I think this is a recommendation of a colleague online, and clearly the 5 countries need to focus more on providing these very important services for this subpopulation of fishermen in the 3 countries, in the 5 countries. As we indicated, and I said that this was prepared by our ALCO colleagues, and if they had been here, they would give some further background information. But clearly, the details in this IBBSS points to a subpopulation that requires urgent attention, that requires preventive packages to be targeted at the population and to support to reduce new infections among the population. And therefore, in the various countries, the call is to focus on this population as well. We know there's been a lot of focus when it comes to female sex workers, when it comes to men who have sex with men, when it comes to other key population subgroups depending on the country. But we want to ask countries to begin to focus also on the fishing communities and to make sure that we can reduce new infection among these communities. And the various fishing communities have been mapped out in details in the report that will be loaded. So you will see the towns and specific sub-areas and urban poor communities where there are fishing communities which requires support, which requires attention. And so with this result, we'll be calling on the various countries and the Ministry of Health within these countries to focus on this subpopulation as well and to reduce new infection. Thanks.
Thank you, Dr. Nagai. Let me also take the opportunity to see if you have other questions in person. Yeah. Please, you have the floor.
Hello, good morning. My name is Chimere. I'm from Nigeria, a delegate from Nigeria. I can be late, very sorry. Just came midway to your presentation on IBBSS. The question I have for clarity and understanding is how many communities, fishing communities were captured, particularly in Nigeria? Did you capture all? Are there some states you eliminated? Are there criteria for the elimination? Let me understand. Thank you.
Thank you so much for this question. In fact, we did not capture all. If you have noticed on the survey, we targeted some community. ALCO targeted some community, they did not capture all. And based on that community, they do the survey and they come out with the result that we are sharing today. And what is more important is across the 5 countries, you have noticed that they did not targeted the whole community. If you notice on the presentation, in Nigeria, they targeted something like 500 people, you know, and in some Nigeria, 2,500, 400. It varies, you know. It's a targeted community. They don't take the holistic community to do this survey. And the second question, we are seeing, hello? I want to know if Dr. Aziz is there. If Dr. Aziz is online, he's also from ALCO. He can respond to that question also. Aziz is not there. Okay. Yeah. Now let me give the floor to Dr. Aziz.
I think that's the question from our colleagues from Nigeria. It's a very important one. But one of the key things that is cutting across is the need for the countries to focus on this subpopulation as part of the main intervention framework that we have across the different countries. I think that, of course, because it's a survey, some selected communities across the southern coastline of Nigeria were selected. The report, as I said, I've not been part of this study, but it will be loaded, and I'm sure the details we can take a look at. But what we should begin to advocate strongly is the focus on the fishing communities that we have in the corridor, Nigeria, Benin, Ghana, Togo, and La Côte d'Ivoire, to make sure that we can reach them with services, and especially differentiated services that will be targeting these subpopulation.
Thank you so much, Dr. Nagai. Now let's go to ICASA and see if we have any question and answer about the upcoming ICASA conference. As Dr. Mazima has said, ICASA is this year in Zimbabwe, 4 to 9 December 2023, and we have 3 higher level meetings before the main conference. And it's important that we should inform people that at this stage, the program is ready at 80%. However, it's also important that you should notice that we close the call for abstracts 31st of July. That's very, very important. And at this stage also, we are now unfolding the program for the youth pavilion, youth program, and we are also unfolding the program for the community village. It's very, very important that people should check on our website, you know, the various activities that is going on. At this stage, we can inform you that the government of Zimbabwe is fully ready to welcome the world in Zimbabwe. You know, they have the new complex of the airport that is open, and we are sure that we enjoy doing ICASA 2023. And we are expecting a minimum of 8,000 delegates this year. At this stage, we have more than 1,500 delegates registered, and the program, all the preliminary speakers has accepted to attend the meeting, and the various stakeholders are also involved strongly. Any other question? Yeah, over there.
Probably I will ask the question for clarity and for my people in the KP community in Nigeria. I discussed with some of less privileged persons who are in the KP community, key population, and they declared interest to participate, probably to share and also to learn in the conference. But going through the application process, they mentioned that the scholarship does not cover registration. So I want to clarify that and also take back the message direct from the source. Thank you. I don't know if it's clear. Should I repeat or should I clarify further?
No, it's very clear.
Okay.
Yeah. In fact, you know, scholarship is defined based on various conference organizers. You know, at ICASA, scholarship is transportation, accommodation, and per diem without registration. That is our definition of scholarship. You know, however, if you have a paper and your paper has been accepted, you have the full scholarship plus the registration. That's it. But if your paper is not accepted and your paper is, for example, a poster, maybe we can give you half. It depends on the rate of the poster. This is a new, is an innovative poster, innovative research. We can look at this, but that is the community that are doing it. It's a committee, it's a scholarship committee that is in charge of that, And the criteria are very clear. At ICASA, as I said, full scholarship means that you have all the three without the registration. And partial means that you have two of one of the three, which mean accommodation, transportation, and per diem. Thank you. Any other question? Okay. If there is no more question, I will give the floor. I will give the microphone to Dr. Mazima. Please, Doctor, what are we expecting in Zimbabwe? Because we are representing the host country here.
Okay. Is it on?
Yeah.
Okay. Well, thank you, the Executive Director, for SAA. Again, I'm just emphasizing what I have already presented, that the country is ready as part of its agenda to re-engage. It's ready and to host ICASA. And again, the issue is at that high level where the Deputy Chief Secretary in the Office of the President and Cabinet is actually coordinating all the ministries and agencies to make sure that we have an excellent ICASA. The budget from central government, it has already been taken up by central government, and I think the Secretariat can confirm that. So the new airport is open now, and it's ready to welcome visitors to both Harare and Victoria Falls. So we are waiting for you in December.
Thank you so much, Dr. Mazima. Let me take this opportunity to give the last point about the upcoming ICASA. Let me inform you that in Zimbabwe, you don't need visa. You get your visa upon arrival. That's very, very important. We will not have any issue of visa. If you have it, call me personally. I will sort it out. That's sure. Okay. Saying that, let me take the opportunity to acknowledge the traditional owner of the land on which we meet today. I would also like to pay my respect to elders, past and present. Really, it's very important that we should acknowledge them. And we are here, we are enjoying the country. We have very good facility, and we hope that our leadership in Africa will follow them here, and we can have better facility also in Africa. Thank you so much.